la jambe, elle fait mal.
Knowing how to speak to patients.
Philippe, écoutez-moi. Écoutez-moi. C'est moi qui parle. C'est moi qui
Staying calm.
Demain matin, j'appelle le médecin, je lui demande qu'elle nous prescrive des patchs.
And providing reassurance. Some things can't be learnt from a textbook.
Le soir, je pourrais pas dormir.
Ah bon?
Je vais veiller toute la nuit.
On parie?
Oh.
On parie?
22-year-old Nathaniel is studying medicine. When he's not interning at the hospital or revising, he's working overtime at a retirement home.
Je serai là, je vérifierai. Oh oui! Allez, bonne soirée, Philippe.
Before the start of the Covid-19 crisis in France, Nathaniel alternated every 3 weeks between his hospital internship and class time. When lockdown began, he called the retirement home asking to help out and was quickly given a job.
I try to help out at the moment because things are difficult here. There's a shortage of nurses.
Bonjour, Monsieur Boin. Lequel j'ai fait ce matin?
As a fifth-year medical student, Nathaniel can carry out nursing tasks.
Vous vous rendez compte, il me réveille le matin, il est 7h30, c'est la joie qu'il rentre.
And he runs workshops for the staff.
Est-ce que ça marche? Asseyez-vous, hein? Il est beau quand même, mon miel qui coule.
Today, he's focusing on nutrition for the elderly.
Question qu'on se pose tous tout le temps, combien une personne âgée doit boire d'eau?
He often helps us out when we are short of nurses, particularly at weekends. When he's here, he doesn't have to think about the outside world. He's committed, he works overtime. But I tell him to think of his studies. I'll text him saying, good luck in your exams.
Nathaniel says working at the retirement home has been a breath of fresh air for him, especially during previous lockdowns. Once he gets home, he still has to study.
Item 268, le reflux gastro-œsophagien de l'enfant.
But finding the energy is a struggle.
Moi, j'ai un mot d'ordre.
At the retirement home in the hospital, I have a motto. We must leave our problems behind. The patients are not there to boost our spirits. It's up to us to boost theirs. But sometimes when I get home in the evenings, I'm not that motivated to study because the day has been just so overwhelming.
Recently, 2 residents at the home died. Because it was a Sunday and the doctor wasn't there, it was up to Nathaniel to tell the families.
The first time a patient died when I was on shift, it was expected, but my voice was still trembling when I told the family, I'm human after all. I thought I could control myself, but a tear did fall. It was even harder the second time a patient died, because I knew her well. I called her daughter and she was devastated. I really struggled to keep it together.
While working on the front line of the Covid-19 crisis, medical students nearing the end of their studies are preparing for a national competitive exam that will determine the specialty they can choose.
This exam will determine what we're able to do with the rest of our careers. So it's a really stressful situation for us students. Every day, honestly, every single day, I get messages from students asking for help, for psychological support, or who just need to talk because they're lonely and they can't spend time with their friends at medical school. It's easy to see how some of them have breakdowns. We need to support these students because we can't help our patients properly if we're in poor health ourselves.
Si nous-mêmes, nous ne sommes pas soignés et si nous-mêmes, nous ne sommes pas en bonne santé. Je te sors une tasse, Alix?
Alex learnt the hard way.
Ouais, mais ce soir, je dois réviser.
Last April, when she was interning at an intensive care unit, a doctor signed her off work for physical and mental exhaustion.
Je fasse mon footing tout à l'heure. Malheureusement, j'ai fait un
I fainted at the doctor's surgery because I was so tired. The doctor told me that I looked exhausted and that my mental health was at risk. We talked for a long time and I was crying. He said, you mustn't feel guilty because otherwise you could get depressed.
Alex's mother felt helpless.
Oui, de la voir fatiguée comme ça, se mettre à pleurer.
Seeing her tired like that, crying for no particular reason, worried me a lot. I thought she'd taken on too much. It's great that she wants to help, and it's what she's chosen to do with her life. But working with the emergency services on top of her work at the hospital, her studies, she spread herself too thin.
Yes, but working with the emergency services did me good.
I know, but it was too much. You weren't sleeping.
Alex is far from an isolated case.
Before, I thought I was the only one stressing out at medical school, the only one who needed to talk to someone. But then when I discussed it with some classmates, we realized that that student is seeing a psychologist. Another is taking antidepressants, and so is he and she. A lot of us need mental health support because our studies are stressful in the first place. But with the context right now, it's even worse.
Alex's internship at the intensive care unit has ended now. She's still working with the emergency services, but says she's looking after her health better now and concentrating on revising for her exams. And when she needs to wind down after a long day, she goes for a run.